Hi, this is Dr. Anupam Sinha, and I am the doctor implantologist at Orion Orthodontic and Dental Care Center, New Delhi, Greater Kailash 1. Today, I would be talking to you about dental implants in general, about the positive and negative aspects of dental implants. One generally has these kind of questions when they come to the clinic as to what is the advantage or disadvantage of a dental implant over a bridge or over dentures. So let me just start with the dentures first. Now, most patients of the earlier generation used to get their teeth replaced by using either a removable or a removable denture, which may be either a partial denture replacing a few teeth or a complete denture replacing all the teeth. Now, these removable as well as full dentures, they tend to have certain misgivings or shortcomings. For example, the most common problem that elderly people used to find with full or complete dentures was the fact that the dentures tend to come loose while they are talking or while they are eating or they are yawning, and which was socially a very embarrassing situation, especially when you are interacting with other people. The other problem that people tend to have is that the dentures would after a while start hurting or pinching the gum area and lead to ulcerations or some kind of irritation in the jaw. Now, this generally tends to happen because of the fact that the jaw bone tends to eventually shrink with age. Once the teeth are removed, the jaw bone, because the jaw bone is basically supporting the teeth, and the act of chewing helps to maintain the bone in a healthy situation. But once we get rid of the teeth, the jaw bone has no function to serve, and thereby they lose the blood supply and eventually they start shrinking. So we may be making a denture with a bone which is at different level, but eventually over say 5 years or 7 years, the bone tends to go on shrinking, and the dentures then start hurting the patient as well as becoming loose. So that is one of the biggest disadvantages of dentures, besides that, of course, the dentures have to be constantly taken out and kept in water, which may be again embarrassing. Even with your closest of family members, like with your son or your daughter or your wife, one may not feel comfortable taking out your teeth and putting them in a glass of water every night before you go to sleep. Now, for me, I think that is the worst thing that an individual can have to suffer, is to have to remove their teeth and place it in a glass of water. Especially when you have much better options like dental implants and implant supported bridges. Now, coming to the bridges, now bridges are basically the false teeth which are supported by your natural teeth. So, supposing you have one tooth that is missing, the support is taken from the two adjacent teeth, and a 3-unit or a 5-unit or a 4-unit bridge may be built, supported on say 2 or 3 teeth. Now, the disadvantages of these bridges is the fact that you essentially have to reduce the size of healthy teeth to be able to put a bridge in place. Over a long run, you will eventually lose these teeth which support the bridge, because you are placing the load of 3 teeth or more on 2 teeth or 3 teeth. Like supposing you make a 5-unit bridge or 3 teeth, the 3 teeth are going to bear the brunt of the forces for 5 teeth, and they are not designed to take that kind of load. So eventually they tend to fail, not only because of the forces but also because of the fact that it's not very easy to maintain hygiene under bridges. That being said, of course, they are a very good option to replace your teeth, but when we have the option of replacing teeth by using dental implants, and the affordability and the bone support is there, then one should choose for the option of going in for dental implants.